Question 1. The risk matrix shows a 72-year-old male with a history of hypertension and hyperlipidemia who experiences sudden onset of left-sided weakness and slurred speech, lasting approximately 15 minutes before resolving completely. He denies any residual symptoms. What is the most appropriate next step in managing this patient, according to current American Academy of Neurology guidelines for suspected transient ischemic attack, TIA? Option A. Refer the patient for an outpatient carotid ultrasound within 48 hours and initiate antiplatelet therapy. Option B. Admit the patient for inpatient observation and urgent neuroimaging. Option C. Arrange for outpatient neuroimaging and cardiology consultation within 1 week. Option D. Prescribe aspirin and advise the patient to follow up with his primary care physician in 1 month. The correct answer is C. Arrange for outpatient neuroimaging and cardiology consultation within 1 week. Explanation. The risk matrix shows a patient presenting with symptoms highly suggestive of a transient ischemic attack TIA. The professional challenge lies in accurately assessing the risk of stroke and determining the appropriate urgency of further investigation and management, balancing the need for prompt intervention with resource allocation and patient safety. This requires a nuanced understanding of TIA pathophysiology, risk stratification tools, and the regulatory framework governing neurological care. The correct approach represents best professional practice by prioritizing immediate, evidence-based risk stratification and management for a suspected TIA. This aligns with the American Academy of Neurology on guidelines, which emphasize the importance of rapid assessment to identify patients at high risk of early recurrent stroke. Prompt referral to a specialist or dedicated TIA clinic, as per AAN recommendations, is crucial for timely intervention with antiplatelet therapy, statins, and potentially anticoagulation, thereby reducing the risk of a subsequent, potentially devastating stroke. This approach is ethically sound, prioritizing patient well-being and adherence to established clinical standards. An incorrect approach would be to delay further investigation or management based on the transient nature of the symptoms alone, without a formal risk assessment. This fails to acknowledge that even transient symptoms can indicate significant underlying cerebrovascular disease and a high risk of imminent stroke. Such a delay would be a failure to adhere to AAN guidelines and could be considered a breach of professional duty of care, potentially leading to adverse patient outcomes. Another incorrect approach would be to manage the patient solely with symptomatic treatment without investigating the underlying cause, which ignores the potential for a serious underlying condition and the need for preventative measures. This also deviates from best practice and regulatory expectations for comprehensive neurological assessment. Professionals should utilize a decision-making framework that begins with a thorough history and physical examination, followed by the application of validated risk stratification tools, e.g., APT-2 score, although newer methods are evolving. Based on the risk assessment, the framework dictates the appropriate pathway for investigation, which may include neuroimaging, CT or MRI, carotid Doppler ultrasound, and cardiac evaluation. The urgency of these investigations and subsequent management decisions should be guided by the identified risk level and current AAN recommendations for TIA management. Question 2. The evaluation methodology shows 2 patients presenting with distinct neurological symptoms. Patient A exhibits symptoms consistent with dopaminergic pathway dysfunction, while patient B's presentation suggests a serotonergic system imbalance. Considering the diverse roles of neurotransmitters and their receptors in modulating neuronal activity, which comparative analytical approach best guides the selection of appropriate therapeutic interventions for each patient? Option A. Differentiating therapeutic strategies based on the specific receptor subtypes affected by the neurotransmitter imbalance in each patient, and considering the downstream signaling cascades initiated by receptor activation or blockade. Option B. Recommending treatments based on the historical success of similar interventions in unrelated neurological conditions, assuming a shared underlying pathophysiology. Option C. Prioritizing treatments that have shown general efficacy in improving mood and motor function, without detailed consideration of the specific neurotransmitter or receptor mechanisms involved. Option D. Applying a broad-spectrum treatment targeting the most commonly implicated neurotransmitter in each patient's symptom category, irrespective of specific receptor involvement. The correct answer is A. differentiating therapeutic strategies based on the specific receptor subtypes affected by the neurotransmitter imbalance in each patient, and considering the downstream signaling cascades initiated by receptor activation or blockade. Explanation. The evaluation methodology shows a scenario where a neurologist is presented with two distinct patient cases, each exhibiting symptoms suggestive of a neurotransmitter imbalance, potentially involving different receptor subtypes or downstream signaling pathways. The professional challenge lies in accurately differentiating between these conditions based on clinical presentation and diagnostic findings, and then selecting the most appropriate therapeutic strategy. This requires a deep understanding of the nuanced roles of various neurotransmitters and their corresponding receptors in neurological function and dysfunction. Careful judgment is required to avoid misdiagnosis and inappropriate treatment, which could exacerbate symptoms or lead to adverse effects. The correct approach represents best professional practice because it involves a systematic, evidence-based comparative analysis of the neurotransmitter and receptor profiles implicated in each patient's presentation. This aligns with the American Academy of Neurology's commitment to high-quality patient care and the ethical imperative to provide accurate diagnoses and effective treatments. By considering the specific receptor affinities, downstream effects, and potential drug interactions related to different neurotransmitter systems, the neurologist can tailor interventions to the individual patient's needs, maximizing therapeutic benefit while minimizing risk. This approach is grounded in the scientific literature and the established understanding of neuropharmacology, which are core competencies assessed in the American Academy of Neurology certification exam. An incorrect approach that focuses solely on the most common neurotransmitter implicated in a broad category of neurological symptoms, without considering the specific receptor subtypes or the unique clinical features of each patient, would be professionally unacceptable. This failure to conduct a differential diagnosis based on the specific neurobiological underpinnings of each case represents a lapse in clinical reasoning and adherence to best practices in neurology. It could lead to prescribing a medication that targets the wrong receptor, rendering the treatment ineffective or even harmful. Another incorrect approach would be to prioritize a treatment based on anecdotal evidence or personal preference, rather than on established scientific evidence and regulatory guidelines for the specific neurotransmitter and receptor systems involved. This disregard for evidence-based medicine and regulatory compliance is a significant ethical and professional failing. It undermines patient safety and the integrity of neurological practice. A further incorrect approach might involve generalizing treatment strategies across different neurological conditions that share superficial symptom similarities, but have distinct underlying neurotransmitter and receptor dysfunctions. This lack of specificity in diagnosis and treatment planning is a critical error, as it fails to address the root cause of the neurological deficit and can lead to suboptimal outcomes. A professional decision-making process for similar situations should involve a thorough review of the patient's history, physical examination findings, and any available diagnostic data. This should be followed by a comprehensive understanding of the neurochemistry of the suspected conditions, including the specific neurotransmitters and receptor subtypes involved. A comparative analysis of the evidence for different therapeutic interventions targeting these systems is crucial. Finally, the decision should be made in consultation with current clinical guidelines, and when necessary, with colleagues, ensuring the most appropriate and evidence-based care for each individual patient. Question 3. Stakeholder feedback indicates a need for greater clarity on the differential diagnostic process when a patient presents with a constellation of symptoms that could implicate both the brainstem and cerebellum. A 65-year-old male presents with progressive gait ataxia, dysarthria, and intermittent diplopia. He also reports occasional episodes of dizziness and has noted a slight tremor in his hands when reaching for objects. Neurological examination reveals nystagmus, impaired finger-nose testing, and a positive Romberg sign. Given these findings, which of the following diagnostic strategies best reflects a systematic and evidence-based approach to localize the neurological deficit? Option A. Perform a lumbar puncture to rule out infectious or inflammatory causes and defer neuroimaging until after the cerebrospinal fluid results are available. Option B. Order an MRI of the brain with specific sequences optimized for the posterior fossa and brainstem, and correlate findings with a detailed neurological examination focusing on cranial nerve deficits, long tract signs, and cerebellar function. Option C. Initiate empirical treatment for a presumed vestibular disorder given the reported dizziness and nystagmus, and reassess in 1 month. Option D. Order a CT scan of the brain to quickly assess for acute hemorrhage or mass effect, and proceed with treatment based on the most likely diagnosis from the CT findings. The correct answer is B. Order an MRI of the brain with specific sequences optimized for the posterior fossa and brainstem, and correlate findings with a detailed neurological examination focusing on cranial nerve deficits, long tract signs, and cerebellar function. Explanation. Scenario analysis. This case presents a professional challenge due to the complexity of diagnosing and managing a patient with symptoms suggestive of both brainstem and cerebellar dysfunction. Differentiating between these two interconnected yet distinct neurological regions requires a nuanced understanding of their respective roles in motor control, coordination, and vital functions. The challenge is amplified by the potential for overlapping symptoms and the need to integrate various diagnostic modalities, including detailed neurological examination, neuroimaging, and potentially other investigations, while adhering to established clinical guidelines and ethical standards for patient care. Correct approach analysis. The correct approach emphasizes a systematic, evidence-based diagnostic process that prioritizes accurate localization of the lesion. This involves a thorough neurological examination focusing on specific signs of brainstem, e.g., cranial nerve deficits, long tract signs, altered consciousness, and cerebellar, e.g., ataxia, dysmetria, intention tremor, nystagmus dysfunction. Neuroimaging, particularly MRI of the brain with appropriate sequences, is crucial for visualizing structural abnormalities in these regions. The correct approach aligns with the American Academy of Neurology's commitment to evidence-based medicine and patient-centered care, ensuring that diagnostic and therapeutic decisions are guided by the best available scientific knowledge and ethical principles, promoting patient safety and optimal outcomes. Incorrect approach is analysis. One incorrect approach might involve prematurely attributing all symptoms to a single etiology without a comprehensive differential diagnosis. This could lead to misdiagnoses, delayed treatment, and potential harm to the patient. Ethically, this represents a failure to provide adequate and thorough medical care, potentially violating the principle of beneficence. Another incorrect approach could be to rely solely on a single diagnostic tool, such as a basic CT scan, when an MRI is indicated for better visualization of the posterior fossa structures. This failure to utilize appropriate diagnostic technology, as recommended by current neurological standards, could result in misdiagnosis or incomplete assessment, contravening the principle of non-maleficence by exposing the patient to potential harm from an incorrect diagnosis or treatment. A third incorrect approach might involve initiating empirical treatment without a clear diagnosis, especially if the symptoms are severe or rapidly progressing. While some conditions may warrant prompt intervention, a lack of diagnostic certainty can lead to ineffective or even harmful treatments, and it fails to address the underlying cause, which is a fundamental ethical and professional obligation. Professional reasoning. Professionals should approach such cases by first conducting a comprehensive history and physical examination, meticulously documenting findings related to brainstem and cerebellar function. This should be followed by formulating a differential diagnosis that considers common and critical conditions affecting these areas. The next step involves selecting appropriate diagnostic investigations, prioritizing those that offer the highest diagnostic yield and are consistent with current best practices and guidelines. Treatment decisions should be based on the confirmed diagnosis and tailored to the individual patient's needs, with ongoing monitoring and reassessment. This systematic, evidence-based, and patient-centered approach ensures adherence to professional standards and ethical obligations. Question 4. Compliance review shows a neurologist's documentation of a patient presenting with unilateral facial weakness. The review notes that, while the neurologist documented observing the patient smiling and frowning, there was no specific mention of testing for pupillary light reflexes, extraocular movements, or olfactory sensation. Which of the following approaches best reflects the expected standard of care for a cranial nerve assessment under the American Academy of Neurology certification framework? Option A. Systematically testing all 12 cranial nerves, documenting findings for each, including pupillary responses, extraocular movements, and olfactory function, alongside the observed facial movements. Option B. Focusing the cranial nerve assessment solely on the nerve suspected to be involved based on the presenting symptom of facial weakness. Option C. Documenting only the gross motor function of the facial nerve, Roman 7, based on the patient's ability to smile and frown. Option D. Relying on the patient's self-report of visual acuity and hearing, without performing objective tests for cranial nerves Roman 2 and Roman 8. The correct answer is A. Systematically testing all 12 cranial nerves, documenting findings for each, including pupillary responses, extraocular movements, and olfactory function, alongside the observed facial movements. Explanation. This scenario presents a professional challenge in ensuring accurate and comprehensive patient care within the specific regulatory framework of the American Academy of Neurology on certification. The core issue revolves around the appropriate documentation and interpretation of cranial nerve assessments, which are fundamental to neurological diagnosis and patient management. Adherence to AAN guidelines is paramount for maintaining certification and upholding professional standards. The correct approach represents best professional practice because it aligns directly with the AAN's emphasis on systematic and thorough patient evaluation. A comprehensive cranial nerve assessment, including testing for all 12 nerves and documenting findings meticulously, ensures that potential neurological deficits are identified early and accurately. This systematic approach is crucial for developing effective treatment plans and monitoring patient progress, directly reflecting the AAN's commitment to high-quality neurological care. An incorrect approach that focuses solely on gross motor function of the face without systematically assessing all cranial nerves would represent a failure to meet the AAN standards for a complete neurological examination. This oversight could lead to misdiagnoses of subtle cranial nerve palsies, impacting patient outcomes and potentially violating ethical obligations to provide thorough care. Another incorrect approach, such as relying on a patient's subjective report of vision without objective testing of visual acuity and fields, would similarly fall short of the detailed assessment expected by the AAN, potentially leading to misdiagnosis or delayed treatment. A third incorrect approach, neglecting to document the findings of the cranial nerve assessment, would be a direct breach of professional record-keeping standards, hindering continuity of care and making it impossible to track changes over time, which is a critical component of neurological practice as outlined by professional bodies like the AAN. The professional decision-making process in such situations should involve a thorough understanding of the AAN certification requirements and clinical guidelines. Professionals must prioritize a systematic, evidence-based approach to patient assessment, ensuring all components of the neurological examination, including detailed cranial nerve testing, are performed and documented. When faced with a situation where a patient's condition might involve cranial nerve dysfunction, the professional should consult relevant AAN practice parameters and guidelines to ensure the assessment and subsequent management are aligned with current best practices. Question 5. Benchmark analysis indicates that diagnostic pathways for patients presenting with symptoms suggestive of peripheral nervous system dysfunction can be optimized. Considering a patient with progressive distal sensory and motor deficits in the lower extremities, which of the following diagnostic strategies best exemplifies a process optimization approach aligned with current neurological best practices? Option A. Conduct a comprehensive history and physical examination to localize the deficit and identify potential etiologies, followed by targeted electrodiagnostic studies, and then further investigations based on initial findings. Option B. Begin empirical treatment with a broad-spectrum immunosuppressant while awaiting results of initial laboratory investigations for metabolic and infectious causes. Option C. Initiate a broad panel of laboratory tests including autoimmune markers, vitamin levels, and genetic screening, followed by nerve conduction studies and electromyography. Option D. Proceed directly to nerve conduction studies and electromyography to objectively assess nerve and muscle function, deferring detailed history and physical examination until results are available. The correct answer is C. Initiate a broad panel of laboratory tests including autoimmune markers, vitamin levels, and genetic screening, followed by nerve conduction studies and electromyography. Explanation. Scenario analysis. This scenario presents a common challenge in neurology practice where a patient exhibits symptoms suggestive of a peripheral nervous system PNS disorder, but the diagnostic pathway is complex and requires careful consideration of various etiologies. The challenge lies in efficiently and accurately identifying the underlying cause to initiate appropriate management, while adhering to established diagnostic standards and patient safety principles. The need for process optimization stems from the potential for delayed diagnosis, unnecessary testing, and suboptimal patient outcomes if the diagnostic approach is not streamlined. Correct approach analysis. The correct approach emphasizes a systematic and evidence-based diagnostic strategy, beginning with a thorough history and physical examination to localize the lesion and identify potential contributing factors. This is followed by targeted electrodiagnostic studies, nerve conduction studies, and electromyography to confirm the presence and severity of neuropathy and to differentiate between axonal and demyelinating processes. Further investigations, such as laboratory tests for metabolic or inflammatory causes and imaging if indicated, are then employed based on the initial findings. This approach aligns with the American Academy of Neurology (AN) guidelines for the diagnosis and management of peripheral neuropathies, prioritizing cost-effectiveness, diagnostic yield, and patient well-being. It represents best professional practice by ensuring that diagnostic resources are utilized judiciously and that the diagnostic process is logical and progressive, minimizing patient discomfort and anxiety. Incorrect approaches analysis. An approach that immediately proceeds to extensive and broad laboratory testing without a focused clinical assessment risks significant overinvestigation, increased healthcare costs, and potential for incidental findings that may not be clinically relevant. This deviates from best practice by not prioritizing the most likely diagnoses based on clinical presentation, potentially leading to a delay in identifying the true cause of the neuropathy. It also fails to adhere to the principle of judicious resource utilization, which is implicitly encouraged by professional guidelines aimed at efficient patient care. Another incorrect approach would be to solely rely on electrodiagnostic studies without a comprehensive clinical evaluation. While electrodiagnostic studies are crucial, they are interpretative tools that gain their full value when correlated with clinical findings. Without a detailed history and physical, the electrodiagnostic results may be misinterpreted or lead to a broad differential that is not clinically supported, thus not optimizing the diagnostic process. This approach risks missing crucial historical clues or physical signs that could point towards a specific etiology. A third incorrect approach might involve initiating empirical treatment for a presumed diagnosis without adequate diagnostic confirmation. While prompt treatment is desirable, treating without a clear diagnosis, especially for a condition with diverse etiologies like peripheral neuropathy, can mask the underlying disease, complicate future diagnostic efforts, and potentially lead to adverse effects from inappropriate medications. This approach bypasses the essential step of accurate diagnosis, which is a fundamental ethical and professional obligation. Professional reasoning. Professionals should approach diagnostic challenges by first synthesizing all available clinical information from the patient's history and physical examination. This forms the foundation for generating a differential diagnosis. Next, they should consider the diagnostic yield and cost-effectiveness of various investigations as outlined by professional guidelines, such as those from the AAN. The diagnostic plan should be iterative, with subsequent investigations guided by the results of earlier ones. This systematic, evidence-based approach ensures that patient care is both effective and efficient, minimizing unnecessary burdens on the patient and the healthcare system. Question 6. The efficiency study reveals that a neurology clinic's diagnostic workflow for suspected stroke patients is experiencing significant delays, impacting patient outcomes. Which of the following represents the most appropriate initial step for the neurology department to address these delays while ensuring optimal patient care? Option A. Conduct a comprehensive review of the entire diagnostic pathway, from patient presentation to definitive diagnosis, identifying specific points of delay and evaluating the impact on the interpretation of brain structure and function. Option B. Rely on the collective experience of senior neurologists to identify and implement changes to the workflow based on their individual practices. Option C. Prioritize reducing the time for initial imaging acquisition, even if it means compromising the detail or scope of the scans, to get preliminary results faster. Option D. Immediately implement a policy to reduce the time allocated for neurological examinations, assuming that faster assessments will expedite the overall process. The correct answer is A. Conduct a comprehensive review of the entire diagnostic pathway, from patient presentation to definitive diagnosis, identifying specific points of delay and evaluating the impact on the interpretation of brain structure and function. Explanation. The efficiency study reveals that a neurology clinic's diagnostic workflow for suspected stroke patients is experiencing significant delays, impacting patient outcomes. This scenario is professionally challenging because it directly affects patient care quality and safety, requiring neurologists to balance diagnostic accuracy with timely intervention. The pressure to reduce wait times must not compromise the thoroughness of neurological assessment, which relies on a deep understanding of brain structure and function. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based evaluation of the diagnostic pathway, focusing on identifying bottlenecks that impede the timely and accurate assessment of brain structure and function. This aligns with the American Academy of Neurology's commitment to promoting high-quality neurological care and patient safety through continuous improvement and adherence to best practices in stroke management. It involves a multidisciplinary review, considering factors like imaging protocols, physician interpretation times, and communication pathways, all aimed at optimizing the diagnostic process without sacrificing diagnostic integrity. An incorrect approach that focuses solely on reducing imaging acquisition time, without considering the subsequent interpretation and integration of findings into a clinical diagnosis, fails to address the full scope of the diagnostic workflow. This could lead to rushed interpretations, potentially missing subtle but critical abnormalities in brain structure or function, thereby compromising patient safety and diagnostic accuracy. This approach would be ethically problematic as it prioritizes speed over patient well-being and could violate professional standards of care. Another incorrect approach that involves bypassing certain diagnostic steps, such as a detailed neurological examination or specific imaging sequences, based on preliminary, incomplete information, is also professionally unacceptable. This disregards the nuanced relationship between clinical presentation and underlying brain pathology, which is fundamental to neurological diagnosis. Such an approach risks misdiagnosis, delayed or inappropriate treatment, and could be seen as a deviation from established diagnostic protocols and ethical obligations to provide comprehensive care. A further incorrect approach that relies on anecdotal evidence or personal experience to alter established diagnostic protocols without rigorous evaluation or evidence-based justification is also flawed. Neurological diagnosis, particularly for conditions like stroke, requires adherence to validated diagnostic algorithms and an understanding of the specific structural and functional deficits associated with different types of cerebrovascular events. Deviating from these without a sound, evidence-based rationale undermines the scientific foundation of neurological practice and patient safety. The professional decision-making process for similar situations should involve a structured, evidence-based approach. This includes 1. Clearly defining the problem and its impact on patient care. 2. Gathering data to understand the current workflow and identify specific areas for improvement. 3. Consulting relevant AAN guidelines and best practice recommendations for stroke diagnosis and management. 4. Involving a multidisciplinary team in the evaluation and solution development. 5. Implementing changes systematically and monitoring their effectiveness. And 6. Maintaining a commitment to continuous quality improvement in patient care, always prioritizing patient safety and diagnostic accuracy, informed by a deep understanding of brain structure and function. Question 7. The assessment process reveals a patient presenting with new-onset tremors and gait instability. Which of the following approaches to gathering family and social history best aligns with comprehensive neurological best practice? Option A. Asking broadly about any neurological problems in the family without specific probing, and inquiring about the patient's hobbies and leisure activities. Option B. Focusing solely on the patient's current symptoms and their direct impact on daily activities, deferring detailed family and social history to a later, unspecified appointment. Option C. Documenting the patient's stated family history of bad nerves and noting their employment status without further elaboration on either aspect. Option D. Inquiring about any diagnosed neurological conditions in immediate family members and asking about the patient's current living situation and primary occupation. The correct answer is D. Inquiring about any diagnosed neurological conditions in immediate family members and asking about the patient's current living situation and primary occupation. Explanation. The assessment process reveals a patient presenting with symptoms suggestive of a neurological disorder. A thorough family and social history is crucial for identifying potential genetic predispositions, environmental exposures, and lifestyle factors that can significantly influence the diagnosis, management, and prognosis of neurological conditions. The challenge lies in eliciting this sensitive information accurately and comprehensively, while maintaining patient trust and confidentiality, adhering to the American Academy of Neurology on guidelines for patient care and ethical practice. The correct approach emphasizes a systematic and empathetic inquiry into the patient's family medical history, including neurological conditions and their social environment, such as occupation, living situation, and support systems. This aligns with best practices as outlined by the AAN, which advocate for a holistic patient evaluation that considers all contributing factors to health and disease. Gathering this information allows for a more personalized and effective treatment plan, potentially identifying at-risk family members, and understanding the impact of social determinants of health on the patient's neurological condition. An incorrect approach would be to dismiss or inadequately explore the family and social history due to time constraints or perceived irrelevance. This failure to gather critical contextual information is a direct contravention of comprehensive neurological assessment principles and could lead to misdiagnosis or suboptimal treatment. Specifically, neglecting to inquire about a family history of similar neurological symptoms, even if not explicitly diagnosed, represents an ethical lapse in due diligence, potentially missing a heritable component of the patient's condition. Similarly, ignoring the patient's social support network or occupational exposures overlooks significant factors that can impact adherence to treatment, symptom exacerbation, and overall well-being, thereby failing to meet the standard of care expected in neurological practice. Professionals should approach family and social history taking with a structured yet flexible methodology. This involves starting with broad questions and then delving into specifics based on the patient's responses. Building rapport and demonstrating genuine interest are paramount. Professionals must be aware of potential cultural sensitivities and adapt their questioning accordingly. If a family history of neurological issues is identified, further exploration into the specific conditions, age of onset, and progression is warranted. Likewise, understanding the patient's social environment can reveal stressors, protective factors, or environmental triggers that are integral to managing their neurological health. This systematic, empathetic, and thorough approach ensures that all relevant information is captured to provide the best possible patient care. Question 8. The monitoring system demonstrates that a patient with a newly diagnosed neurological condition reports subjective improvement in their symptoms after initiating a new medication. What is the most appropriate next step in the management of this patient? Option A. Rely solely on the patient's subjective report of symptom improvement to confirm the medication's efficacy and continue current dosing. Option B. Schedule a follow-up appointment to objectively assess the patient's response using validated neurological assessment tools and compare findings to baseline measurements. Option C. Immediately discontinue the medication and explore alternative treatment options based on the patient's subjective report of improvement. Option D. Attribute the reported improvement entirely to the new medication without further investigation, assuming a direct therapeutic effect. The correct answer is B. Schedule a follow-up appointment to objectively assess the patient's response using validated neurological assessment tools and compare findings to baseline measurements. Explanation. Scenario analysis. This scenario presents a common challenge in neurology where a patient's subjective report of symptom improvement following a new medication needs to be objectively validated. The challenge lies in distinguishing genuine therapeutic effect from placebo response, patient expectation, or natural fluctuation of the condition. It requires a systematic approach to diagnosis and management, adhering to evidence-based practices and patient-centered care principles. Correct approach analysis. The correct approach involves a structured, objective assessment of the patient's response to the new medication. This aligns with best practices in clinical neurology, emphasizing the importance of objective data to confirm or refute the efficacy of an intervention. The American Academy of Neurology on guidelines advocate for rigorous evaluation of treatment outcomes, including the use of validated assessment tools and, where appropriate, comparative measures. This approach ensures that treatment decisions are based on evidence of benefit and minimizes the risk of continuing ineffective or potentially harmful therapies. It also respects the patient's experience while maintaining scientific integrity in clinical practice. Correct approach is analysis. One incorrect approach involves relying solely on the patient's subjective report without further objective assessment. This fails to meet the AAN standards for evidence-based practice, which necessitate objective validation of treatment efficacy. Ethically, it could lead to continued treatment that is not demonstrably beneficial, potentially exposing the patient to unnecessary side effects or costs, and delaying consideration of alternative, more effective treatments. Another incorrect approach is to immediately discontinue the medication based on a lack of perceived improvement, without a structured reevaluation. This prematurely dismisses a potentially beneficial treatment and overlooks the possibility of delayed response or the need for dose adjustment. It deviates from a systematic management plan and may not align with established protocols for assessing therapeutic response in neurological conditions. A third incorrect approach is to attribute any perceived improvement solely to the medication without considering other contributing factors. This oversimplifies the diagnostic and management process and can lead to inaccurate conclusions about treatment effectiveness. It neglects the comprehensive evaluation required by best practices, which includes considering the natural history of the disease, potential placebo effects, and other concurrent interventions or lifestyle changes. Professional reasoning. Professionals should approach such situations by first establishing clear, objective outcome measures at the initiation of treatment. This involves defining what constitutes a meaningful improvement based on validated scales or functional assessments relevant to the patient's condition. Regular follow-up should include reassessment using these objective measures, alongside a thorough review of the patient's subjective experience. If objective improvement is not evident, a systematic process of reevaluation, considering dose adjustments, alternative medication, or non-pharmacological interventions should be initiated. This iterative process ensures that patient care is guided by evidence, safety, and efficacy, in accordance with professional standards and ethical obligations. Question 9. Operational review demonstrates that a patient presents with a constellation of symptoms, including intermittent dizziness, fatigue, and a subjective sense of unsteadiness, which have been present for several months. The patient also reports significant anxiety related to these episodes. During the patient interview, the neurologist needs to effectively gather information to formulate an accurate diagnosis. Which of the following interview techniques best aligns with best professional practice in this scenario? Option A. Immediately focus on objective neurological examination findings and laboratory results, asking the patient to confirm or deny specific neurological deficits, while downplaying the subjective nature of their reported symptoms. Option B. Adopt a direct, interrogative approach to probe the patient's anxiety levels and potential psychological stressors, framing these as the primary cause of their symptoms, without first thoroughly exploring the neurological history. Option C. Primarily ask a series of closed-ended questions about the timing, duration, and intensity of each symptom, limiting opportunities for the patient to elaborate on their overall experience or potential triggers. Option D. Begin with open-ended questions to allow the patient to describe their symptoms and experiences in their own words, then transition to more specific, targeted questions to clarify details and explore potential contributing factors, including psychological ones, in a non-judgmental and integrated manner. The correct answer is D. Begin with open-ended questions to allow the patient to describe their symptoms and experiences in their own words, then transition to more specific, targeted questions to clarify details and explore potential contributing factors, including psychological ones, in a non-judgmental and integrated manner. Explanation. Scenario analysis. This scenario presents a common challenge in neurology practice where a patient's subjective reporting of symptoms may be influenced by factors beyond purely neurological pathology, such as anxiety or a desire for attention. The neurologist must navigate this complexity while adhering to ethical and professional standards of care, ensuring accurate diagnosis and appropriate management without alienating the patient or compromising their trust. The challenge lies in distinguishing genuine neurological symptoms from those with psychogenic components or other confounding factors, requiring a nuanced interview approach. Correct approach analysis. The correct approach involves a systematic and empathetic exploration of the patient's symptoms, utilizing open-ended questions to encourage detailed descriptions, followed by targeted, closed-ended questions to clarify specific aspects. This method allows the neurologist to gather comprehensive information, identify patterns, and explore potential contributing factors, including psychological ones, in a non-judgmental manner. This aligns with the American Academy of Neurology's ethical guidelines emphasizing patient-centered care, thoroughness in evaluation, and the importance of building a strong physician-patient relationship based on trust and respect. It also reflects best practices in diagnostic reasoning, where a broad differential diagnosis is considered and systematically investigated. Incorrect approaches analysis. One incorrect approach involves immediately dismissing the patient's reported symptoms as purely psychological without adequate exploration. This violates the ethical principle of beneficence, as it fails to thoroughly investigate potential organic causes and could lead to misdiagnosis and delayed or inappropriate treatment. It also undermines the physician-patient relationship, potentially causing the patient to feel unheard and devalued, which is contrary to professional standards of care. Another incorrect approach is to focus solely on objective neurological findings and disregard the patient's subjective experience. While objective findings are crucial, a patient's narrative provides vital context and can highlight subtle clues that might be missed otherwise. Ignoring subjective reports can lead to an incomplete diagnostic picture and may fail to address the patient's primary concerns, impacting their overall well-being and adherence to treatment. A third incorrect approach is to adopt an overly confrontational or interrogative style when exploring potential psychological factors. This can create defensiveness in the patient, shut down communication, and hinder the collection of accurate information. Ethical practice dictates a compassionate and collaborative approach, even when exploring sensitive topics. Professional reasoning. Professionals should approach patient interviews with a framework that prioritizes active listening, empathy, and systematic information gathering. This involves starting with broad, open-ended questions to understand the patient's perspective, then employing more specific questions to refine the differential diagnosis. When psychological factors are suspected, the exploration should be integrated sensitively into the overall history, framed as potential contributors to symptom experience rather than as a dismissal of the symptoms themselves. Maintaining a non-judgmental stance and validating the patient's experience, even while seeking clarification, is paramount. This approach ensures comprehensive evaluation, fosters trust, and aligns with ethical obligations to provide the highest standard of care. Question 10. Comparative studies suggest that the interpretation of neurophysiological data in patients with suspected or confirmed neurological disorders can be complex. A neurologist certified by the American Academy of Neurology is reviewing electroencephalogram (EEG) results for a patient who reports subtle but persistent changes in sensation and mood, which are not clearly reflected in the initial EEG report. The neurologist must decide how to proceed with the interpretation and subsequent management. Which of the following approaches best reflects current AAN guidelines and best practices for integrating neurophysiological findings with evolving clinical presentations? Option A. Immediately order more invasive or expensive diagnostic tests based solely on the patient's subjective reports, without further detailed correlation of the EEG findings with the physical examination and the specific nature of the reported sensory and mood changes. Option B. Dismiss the patient's subjective reports of sensory and mood changes as potentially psychosomatic if they do not directly correlate with the initial EEG interpretation, focusing solely on objective electrophysiological abnormalities. Option C. Prioritize the objective EEG findings as the definitive diagnostic marker and counsel the patient that their subjective symptoms may be unrelated to underlying neurological pathology if the EEG is interpreted as normal or showing only minor, nonspecific changes. Option D. Integrate the EEG findings with a thorough reevaluation of the patient's history, physical examination, and the specific characteristics of the reported sensory and mood changes, considering potential limitations of the EEG and the dynamic nature of neurological conditions, to formulate a comprehensive diagnostic and management plan. Correct answer is C. Prioritize the objective EEG findings as the definitive diagnostic marker, and counsel the patient that their subjective symptoms may be unrelated to underlying neurological pathology if the EEG is interpreted as normal or showing only minor, nonspecific changes. Explanation. Scenario analysis. This scenario presents a professional challenge for a neurologist certified by the American Academy of Neurology when interpreting neurophysiological data in the context of a patient's evolving clinical presentation. The challenge lies in balancing the objective findings from electrodiagnostic studies with the subjective and sometimes subtle changes reported by the patient and observed by the clinician. Misinterpreting or overlying on one aspect of the data can lead to diagnostic errors, delayed appropriate treatment, or unnecessary interventions, all of which have significant implications for patient care and adherence to AAN guidelines for best practices in neurology. Correct approach analysis. The correct approach emphasizes a comprehensive and integrated interpretation of neurophysiological data within the broader clinical context. This aligns with AAN's commitment to evidence-based medicine and patient-centered care. Best professional practice dictates that electrophysiological findings are not viewed in isolation, but are correlated with the patient's history, physical examination, and other diagnostic investigations. This holistic approach ensures that the interpretation is clinically relevant and leads to the most accurate diagnosis and effective management plan, adhering to the principles of responsible neurological practice as outlined by the AAN. Incorrect approaches analysis. One incorrect approach would be to solely rely on the electrophysiological findings, disregarding significant clinical changes or patient reports. This fails to meet the ethical obligation of providing comprehensive patient care and may violate AAN guidelines that stress the importance of integrating all available clinical information. Such an approach risks misdiagnosis or overlooking critical evolving pathology. Another incorrect approach would be to dismiss electrophysiological findings that do not immediately align with a preconceived clinical diagnosis, especially if the patient reports new or worsening symptoms. This demonstrates a bias that can lead to diagnostic errors and potentially harm the patient by delaying appropriate investigation or treatment. It also undermines the scientific validity of electrodiagnostic testing as a diagnostic tool. A third incorrect approach would be to make definitive diagnostic conclusions based on electrophysiological data alone, without considering the potential for artifact, technical limitations, or the dynamic nature of neurological conditions. This lacks the critical analytical rigor expected of a certified neurologist and could lead to inappropriate patient management. Professional reasoning. Professionals should approach such situations by first meticulously reviewing the electrophysiological data, noting any abnormalities or normal findings. Simultaneously, they must thoroughly reevaluate the patient's history, perform a detailed physical and neurological examination, and consider any other relevant investigations. The process involves synthesizing all these pieces of information, looking for concordance and discordance. When discrepancies arise, further investigation or consultation may be warranted. The decision-making framework should prioritize patient safety and well-being, guided by the most current AAN guidelines and ethical principles of medical practice. Question 11. Assessment of a 72-year-old male presenting to the emergency department with sudden onset of left-sided weakness and slurred speech, who has a known history of transient ischemic attacks TIA, requires a structured diagnostic approach. Which of the following represents the most appropriate initial management strategy? Option A. Immediately administer intravenous thrombolytics based on the suspected diagnosis of stroke. Option B. Perform a comprehensive neurological examination, obtain immediate non-contrast head CT, and initiate intravenous access. Option C. Order a battery of laboratory tests, including complete blood count, basic metabolic panel, and coagulation studies, before proceeding with any imaging. Option D. Delay neuroimaging to obtain a detailed past medical history, including all previous neurological events and medications. The correct answer is B. Perform a comprehensive neurological examination, obtain immediate non-contrast head CT, and initiate intravenous access. Explanation. Scenario analysis. This scenario presents a common challenge in neurology, differentiating between a new-onset neurological event and a pre-existing, stable condition, particularly when a patient has a history of neurological issues. The urgency of a potential stroke necessitates rapid and accurate assessment, while avoiding unnecessary interventions that could harm the patient or strain resources. The professional challenge lies in synthesizing clinical information, diagnostic findings, and patient history to arrive at the most appropriate next step in management. Correct approach analysis. The correct approach represents best professional practice by prioritizing a comprehensive neurological examination and immediate neuroimaging. This aligns with established clinical guidelines for suspected acute neurological events, such as stroke. The American Academy of Neurology, (AN), emphasizes evidence-based approaches to diagnosis and management. Prompt imaging, CT or MRI, is crucial to differentiate ischemic from hemorrhagic stroke, which dictates immediate treatment strategies and helps rule out other emergent conditions. A thorough neurological exam provides baseline data and helps localize the deficit, guiding further diagnostic steps. This approach is ethically sound as it prioritizes patient safety and timely, evidence-based care. Incorrect approaches analysis. One incorrect approach involves delaying neuroimaging to first obtain a more detailed patient history. While history is important, in the context of suspected acute stroke, time is brain. Delaying imaging to gather extensive historical details, especially when the patient's presentation is suggestive of an acute event, can lead to missed treatment windows for thrombolysis or thrombectomy, resulting in poorer outcomes and potential regulatory or ethical breaches related to delayed care. Another incorrect approach is to immediately initiate empiric treatment for a specific condition without definitive diagnostic confirmation. For instance, starting anticoagulation without ruling out a hemorrhagic stroke would be a significant ethical and regulatory failure, as it could exacerbate bleeding and cause severe harm. This bypasses essential diagnostic steps and violates the principle of do no harm. A further incorrect approach is to rely solely on laboratory tests without a clinical examination or imaging. While labs can provide supportive information, they are rarely sufficient for the initial diagnosis of an acute neurological event like stroke. This approach is professionally unacceptable as it neglects fundamental diagnostic pillars in neurology and could lead to misdiagnosis and inappropriate management, potentially violating standards of care. Professional reasoning. Professionals should employ a systematic approach that integrates clinical suspicion, physical examination, and diagnostic imaging. The decision-making process should be guided by established clinical pathways and evidence-based guidelines, such as those published by the AAN. When faced with a potentially emergent neurological condition, the priority is to rapidly confirm or exclude life-threatening diagnoses. This involves a tiered approach, starting with a focused history and physical, followed by immediate, targeted investigations like neuroimaging, and then tailoring treatment based on confirmed findings. Ethical considerations, including patient autonomy, beneficence, and non-maleficence, must be paramount throughout the assessment and management process. Question 12. When evaluating a patient presenting with progressive muscle weakness, difficulty with coordination, and intermittent sensory disturbances, which of the following diagnostic considerations best reflects an understanding of potential disruptions in neuronal structure and function? Option A. A generalized decline in neuronal metabolic rate due to aging. Option B. A specific deficit in neurotransmitter synthesis or receptor binding at the neuromuscular junction. Option C. A primary issue with glial cell support and myelination affecting signal propagation. Option D. An overproduction of neurotrophic factors promoting excessive neuronal growth. The correct answer is C. A primary issue with glial cell support and myelination affecting signal propagation. Explanation. Scenario analysis. This scenario presents a challenge in accurately diagnosing a patient's neurological condition based on observed symptoms and a limited understanding of the underlying neuronal mechanisms. The physician must differentiate between conditions affecting different parts of the neuron and their respective functions, requiring a deep understanding of neuroanatomy and neurophysiology. The professional challenge lies in translating clinical presentation into specific cellular or molecular dysfunctions, which is critical for guiding appropriate treatment and prognosis. Correct approach analysis. The correct approach involves a systematic evaluation of the patient's symptoms and correlating them with known disruptions in neuronal structure and function. Identifying specific deficits, such as impaired neurotransmitter release or altered ion channel activity, allows for a more precise diagnosis. This aligns with best professional practice by grounding diagnostic reasoning in established scientific principles of neurobiology, which is fundamental to neurology. Adherence to evidence-based medicine and diagnostic criteria, which are implicitly guided by the scientific literature underpinning the American Academy of Neurology certification standards, is paramount. Incorrect approach is analysis, an approach that focuses solely on symptom management without investigating the underlying neuronal cause, is professionally unacceptable. This fails to address the root of the problem and may lead to ineffective or even harmful treatments. It neglects the diagnostic rigor expected in neurological practice and deviates from the principle of identifying and treating the disease process. An approach that attributes symptoms to a generalized neuronal fatigue without specific evidence of cellular dysfunction is also professionally unsound. This lacks scientific specificity and does not align with the detailed understanding of neuronal mechanisms required for accurate diagnosis. It represents a failure to apply precise neurobiological knowledge. An approach that relies on anecdotal evidence or unproven therapies, bypassing established diagnostic pathways and treatments, is ethically and professionally problematic. This can endanger the patient by delaying or replacing effective care, and violates the principle of providing evidence-based medical treatment. Professional reasoning. Professionals should approach such cases by first meticulously gathering clinical data, including patient history and neurological examination findings. This data should then be analyzed through the lens of known neuronal structures and functions. The process involves forming differential diagnoses based on symptom patterns, and then seeking further investigations, e.g., neuroimaging, electrophysiology, laboratory tests, to confirm or refute these hypotheses. This systematic, evidence-based approach ensures that diagnostic and therapeutic decisions are informed by a robust understanding of neurobiology, as expected by the American Academy of Neurology certification standards. Question 13. Strategic planning requires a neurologist to meticulously assess a patient presenting with a constellation of symptoms suggestive of cerebral hemisphere involvement. The patient reports progressive difficulty with word finding, occasional visual disturbances in their left visual field, and a subtle weakness in their right arm. The neurologist must determine the most appropriate initial diagnostic pathway to accurately localize the lesion within the cerebral hemispheres and guide subsequent management. Option A. Perform a detailed neurological examination, including assessment of cranial nerves, motor strength, sensation, coordination, and cognitive functions, followed by prompt neuroimaging, MRI brain with contrast. Option B. Order a comprehensive neuropsychological evaluation immediately, focusing on language and visuospatial deficits to precisely map cognitive impairments. Option C. Prescribe a course of broad-spectrum antibiotics to rule out an infectious etiology affecting the cerebral hemispheres, given the nonspecific nature of some symptoms. Option D. Initiate empiric treatment for a common cerebrovascular event and await patient response before further investigation. The correct answer is D. Initiate empiric treatment for a common cerebrovascular event and await patient response before further investigation. Explanation. Strategic planning in neurology, particularly concerning the cerebral hemispheres, presents unique challenges due to the complexity and interconnectedness of these structures. A neurologist must integrate a patient's clinical presentation, imaging findings, and neurological examination to formulate an accurate diagnosis and treatment plan. This scenario is professionally challenging because subtle differences in hemispheric function can manifest in diverse and sometimes overlapping symptoms, requiring meticulous differential diagnosis and a deep understanding of neuroanatomy and neurophysiology. The American Academy of Neurology, (AN) guidelines emphasize evidence-based practice, patient-centered care, and ethical conduct, all of which are paramount when managing conditions affecting the cerebral hemispheres. The correct approach involves a systematic evaluation that prioritizes patient safety and adherence to established diagnostic and treatment protocols. This includes a thorough history, comprehensive neurological examination focusing on hemispheric functions e.g., language, visuospatial skills, motor control, sensation, and judicious use of neuroimaging and other diagnostic tests. The AAN's practice parameters and ethical standards guide the neurologist in making informed decisions, ensuring that interventions are appropriate, evidence-based, and tailored to the individual patient's needs. This approach upholds the neurologist's duty of care and commitment to providing high-quality neurological services. Incorrect approaches often stem from premature diagnostic conclusions, over-reliance on a single piece of information, or failure to consider the full spectrum of potential etiologies. For instance, focusing solely on a motor deficit without adequately assessing cognitive or sensory changes related to the affected hemisphere could lead to a misdiagnosis or inappropriate treatment. Another failure would be to disregard patient-reported symptoms that, while seemingly minor, could be crucial indicators of hemispheric dysfunction. Ethically, failing to conduct a complete neurological examination or to consider all plausible diagnoses violates the principle of beneficence and non-maleficence. Regulatory frameworks, as interpreted by the AAN, mandate thoroughness and adherence to best practices, making any approach that shortcuts this process professionally unacceptable. Professional decision-making in such cases requires a structured approach. First, gather all relevant clinical data. Second, formulate a broad differential diagnosis based on the patient's symptoms and signs, considering the specific functions of the cerebral hemispheres. Third, utilize diagnostic tools strategically to narrow down the possibilities. And fourth, develop a treatment plan that is evidence-based, patient-centered, and regularly reassessed. This iterative process ensures that the neurologist remains vigilant and adaptable, providing the best possible care for patients with complex neurological conditions. Question 14. The evaluation methodology shows a physician presented with a patient exhibiting acute neurological deficits consistent with an ischemic stroke. The physician's initial actions included a rapid neurological assessment and a non-contrast head CT. The subsequent steps taken by the physician to optimize the patient's care pathway for potential reperfusion therapy are being reviewed. Which of the following sequences of actions best reflects an optimized process for managing acute ischemic stroke according to current American Academy of Neurology guidelines? Option A. Administer intravenous thrombolysis immediately upon suspicion of ischemic stroke, deferring neuroimaging until after treatment initiation. Option B. Proceed directly to mechanical thrombectomy without further imaging if a large vessel occlusion is suspected based on initial clinical assessment. Option C. Initiate supportive care only and await further specialist consultation before considering any acute interventions, regardless of the patient's clinical presentation or time since symptom onset. Option D. Obtain a non-contrast head CT, followed by CT angiography and perfusion imaging to assess for large vessel occlusion and salvageable brain tissue, and then consider intravenous thrombolysis and or mechanical thrombectomy based on findings and time windows. The correct answer is B. Proceed directly to mechanical thrombectomy without further imaging if a large vessel occlusion is suspected based on initial clinical assessment. Explanation: scenario analysis. This scenario presents a challenge in optimizing the diagnostic pathway for acute ischemic stroke, balancing the urgency of reperfusion therapy with the need for accurate and efficient evaluation. The physician must navigate established protocols and consider individual patient factors to ensure timely and appropriate treatment, adhering to the American Academy of Neurology guidelines which emphasize evidence-based practice and patient safety. Correct approach analysis. The correct approach prioritizes rapid assessment and intervention based on established AAN guidelines for acute ischemic stroke. This involves immediate neurological assessment, confirmation of ischemic stroke, and prompt consideration of reperfusion therapies, thrombolysis and or mechanical thrombectomy, based on established time windows and contraindications. This aligns with the AAN's emphasis on evidence-based medicine and process optimization to improve patient outcomes in time-sensitive conditions. Adherence to these guidelines ensures that patients receive the most effective treatments within critical timeframes, minimizing disability. Incorrect approach is analysis, an approach that delays advanced imaging like CT angiography or MRI diffusion-weighted imaging beyond the initial non-contrast CT, in the absence of clear contraindications for reperfusion therapy, represents a failure to adhere to AAN guidelines for optimizing stroke treatment. This delay can lead to missed opportunities for reperfusion, directly impacting patient outcomes and potentially violating the ethical principle of beneficence by not providing the best available care promptly. Another incorrect approach would be to administer thrombolytic therapy without a thorough neurological assessment and confirmation of ischemic stroke via non-contrast CT, or without screening for contraindications. This could lead to inappropriate treatment, potentially causing harm, e.g., hemorrhagic transformation, and violating the ethical principle of non-maleficence. It also deviates from established diagnostic and treatment protocols. An approach that relies solely on clinical presentation without immediate neuroimaging confirmation of ischemic stroke before initiating treatment is also problematic. While clinical suspicion is high, neuroimaging is crucial for confirming the diagnosis, identifying the location and extent of the infarct, and ruling out other conditions that mimic stroke symptoms, all of which are critical for guiding appropriate reperfusion strategies as per AAN recommendations. This failure to confirm the diagnosis through appropriate imaging can lead to incorrect treatment decisions. Professional reasoning. Professionals should adopt a systematic, evidence-based approach to acute ischemic stroke management. This involves rapid assessment of the patient's neurological status, immediate non-contrast CT to rule out hemorrhage and confirm ischemia, followed by advanced imaging, CTA/MRA, to assess for large vessel occlusion and eligibility for mechanical thrombectomy, and consideration of Roman IV thrombolysis based on time windows and contraindications. Continuous review of patient status and adherence to evolving AAN guidelines are paramount. Question 15. Upon reviewing electrophysiological recordings from a patient exhibiting specific motor deficits, a neurologist observes a consistent reduction in the amplitude of the postsynaptic potential at a neuromuscular junction, despite normal action potential propagation to the presynaptic terminal. Which of the following best explains this finding in the context of synaptic transmission? Option A. Enhanced sensitivity of voltage-gated sodium channels. Option B. Reduced duration of the action potential. Option C. Impaired neurotransmitter release from the presynaptic terminal. Option D. Increased frequency of action potential firing. The correct answer is C. Impaired neurotransmitter release from the presynaptic terminal. Explanation. Scenario analysis. This scenario presents a challenge in accurately interpreting electrophysiological data in the context of a patient's neurological condition. Differentiating between normal physiological processes and pathological alterations at the synaptic level requires a nuanced understanding of action potential propagation and neurotransmitter release. The professional challenge lies in applying this knowledge to a clinical scenario where subtle differences in synaptic function could indicate significant underlying pathology, necessitating precise diagnostic interpretation. Correct approach analysis. The correct approach involves recognizing that alterations in synaptic transmission, such as impaired neurotransmitter release or receptor sensitivity, can directly affect the postsynaptic potential and, consequently, the overall excitability of the neuron. This understanding aligns with the core principles of neurophysiology tested in the American Academy of Neurology certification, which emphasizes the functional consequences of cellular mechanisms on neurological function. By identifying these specific synaptic dysfunctions, the clinician can accurately diagnose and manage neurological disorders. Incorrect approach is analysis. An approach that focuses solely on the action potential's arrival at the presynaptic terminal without considering the subsequent events at the synapse is incomplete. This fails to acknowledge the critical role of synaptic transmission in neuronal communication and would miss potential pathologies localized to the synapse itself. This represents a failure in comprehensive neurophysiological analysis. An approach that attributes all observed changes to generalized neuronal fatigue without specific investigation into the synaptic mechanisms is an oversimplification. While fatigue can affect neuronal function, it does not specifically address the detailed processes of neurotransmitter dynamics or receptor binding that are crucial for accurate diagnosis of many neurological conditions. This approach lacks the specificity required for precise clinical decision-making. An approach that dismisses subtle deviations in postsynaptic potentials as insignificant without further investigation into underlying synaptic mechanisms is professionally negligent. These subtle changes can be early indicators of significant neurological dysfunction, and failing to explore their cause violates the principle of thorough diagnostic evaluation. Professional reasoning. Professionals should approach such scenarios by systematically evaluating the entire process of neuronal communication, from action potential generation to postsynaptic integration. This involves considering how each component, including the presynaptic terminal, synaptic cleft, and postsynaptic membrane, can be affected by disease. When interpreting electrophysiological data, it is crucial to correlate observed phenomena with known physiological mechanisms and to investigate any deviations from the norm by considering potential disruptions at the synaptic level. This systematic, mechanism-based approach ensures accurate diagnosis and appropriate patient care. Question 16. During the evaluation of a 55-year-old male presenting with progressive numbness and tingling in his left arm and hand, which he describes as pins and needles, and mild weakness in grip strength, what is the most appropriate next step in assessing for potential spinal nerve involvement? Option A. Advise the patient that his symptoms are likely due to anxiety and suggest relaxation techniques. Option B. Prescribe a course of over-the-counter pain medication and advise the patient to monitor his symptoms for a few weeks before considering further evaluation. Option C. Perform a comprehensive neurological examination, focusing on motor strength, sensation, reflexes, and specific tests for nerve root compression or irritation in the cervical spine. And if findings are suggestive but not definitive, consider cervical spine MRI. Option D. Immediately refer the patient for a nerve conduction study and electromyography, NEMG, of the affected limb without a preceding physical examination. The correct answer is C. Perform a comprehensive neurological examination, focusing on motor strength, sensation, reflexes, and specific tests for nerve root compression or irritation in the cervical spine. And if findings are suggestive but not definitive, consider cervical spine MRI. Explanation. This scenario presents a common clinical challenge where a patient's subjective symptoms suggest a specific neurological issue, but objective findings are initially equivocal. The professional challenge lies in accurately diagnosing the underlying cause of the patient's symptoms, which could stem from a variety of conditions affecting the spinal nerves, and then formulating an appropriate management plan. This requires careful integration of patient history, physical examination findings, and potentially further diagnostic investigations, all while adhering to established neurological diagnostic and management guidelines. The correct approach represents best professional practice because it systematically moves from initial assessment to targeted investigation based on clinical suspicion. It prioritizes a thorough neurological examination to identify objective signs that correlate with the patient's reported symptoms. If the examination is inconclusive, it then proceeds to recommend appropriate diagnostic imaging, such as an MRI, to visualize the spinal cord and nerve roots for structural abnormalities. This aligns with standard neurological practice and the principles of evidence-based medicine, ensuring that diagnostic decisions are guided by clinical findings and supported by objective data. The American Academy of Neurology, ON guidelines, emphasize a structured approach to neurological diagnosis, starting with a comprehensive history and physical, followed by judicious use of diagnostic tools. An incorrect approach that relies solely on the patient's subjective report, without a thorough physical examination, fails to adhere to professional standards of care. This could lead to misdiagnosis or delayed diagnosis, potentially worsening the patient's condition. Ethically, it breaches the duty of care by not performing a complete evaluation. Another incorrect approach, such as immediately ordering invasive procedures without sufficient clinical justification, is not cost-effective and carries unnecessary risks for the patient, violating the principle of do no harm and potentially contravening guidelines on appropriate resource utilization. A third incorrect approach, which dismisses the patient's symptoms without adequate investigation, demonstrates a lack of clinical diligence and empathy, failing to meet professional expectations for patient care. Professionals should employ a decision-making framework that begins with active listening and detailed history-taking, followed by a systematic and comprehensive neurological examination. If initial findings are unclear, the framework dictates considering differential diagnoses, and then selecting the most appropriate and least invasive diagnostic tests to confirm or refute these possibilities, always guided by established clinical pathways and expert consensus recommendations, such as those provided by the AAN. Question 17. The performance metrics show a slight delay in initiating neuroimaging for patients presenting with acute neurological deficits suggestive of stroke, and a tendency for some clinicians to proceed with presumptive treatment based on clinical presentation alone. Considering a patient presenting with sudden onset of severe headache, nausea, vomiting, and focal neurological deficits, including left-sided hemiparesis and aphasia, what is the most appropriate immediate next step in management, adhering strictly to established neurological care pathways and guidelines? Option A. Administer intravenous tissue plasminogen activator TPA. Option B. Aggressively lower blood pressure to below 140/90 mmHg. Option C. Obtain immediate non-contrast head computed tomography (CT scan). Option D. Consult the on-call neurosurgeon for immediate evaluation. The correct answer is C. Obtain immediate non-contrast head computed tomography (CT scan). Explanation: scenario analysis. This scenario is professionally challenging because it requires immediate, high-stakes decision-making in a time-sensitive situation involving a potentially devastating diagnosis. The physician must balance the urgency of initiating treatment with the need for accurate diagnostic confirmation, all while considering the patient's individual risk factors and the potential for iatrogenic harm. The performance metrics highlight a potential deviation from established protocols, necessitating a critical evaluation of the diagnostic and management pathway. Correct approach analysis. The correct approach prioritizes definitive diagnostic imaging to confirm the presence and extent of a hemorrhagic stroke before initiating any interventions that could exacerbate bleeding or be contraindicated. This aligns with established neurological guidelines and best practices for stroke management, emphasizing the critical need for accurate diagnosis to guide appropriate therapy. The American Academy of Neurology, (AN) guidelines strongly advocate for immediate neuroimaging, CT or MRI, to differentiate between ischemic and hemorrhagic stroke, as treatment strategies are diametrically opposed. Delaying imaging or proceeding with treatment based on presumptive diagnosis without confirmation risks significant patient harm, including increased intracranial pressure, rebleeding, or inappropriate administration of thrombolytics in the case of a hemorrhagic event. This approach upholds the ethical principle of beneficence by ensuring that interventions are evidence-based and tailored to the specific pathology, thereby maximizing potential benefit and minimizing harm. Incorrect approach is analysis. Proceeding with intravenous thrombolysis based solely on clinical suspicion of stroke, without confirmatory imaging, represents a critical regulatory and ethical failure. This bypasses the fundamental diagnostic step mandated by stroke protocols and AAN guidelines, directly violating the principle of non-maleficence by exposing the patient to the severe risk of hemorrhagic transformation or exacerbation of existing bleeding. Such an action would be considered a breach of professional standards of care and potentially malpractice. Initiating aggressive blood pressure lowering without confirming the stroke type is also problematic. While hypertension management is crucial in hemorrhagic stroke, it can be detrimental in ischemic stroke. Without imaging, the physician cannot determine the appropriate management strategy, potentially leading to hypoperfusion in an ischemic area or worsening of the hemorrhage. This demonstrates a failure to adhere to diagnostic protocols and a disregard for the specific pathophysiology of the stroke. Consulting a neurosurgeon immediately without obtaining initial diagnostic imaging is premature and inefficient. While neurosurgical consultation may be necessary, it should be informed by definitive imaging findings. This approach delays critical diagnostic steps and may lead to unnecessary resource utilization, failing to adhere to a systematic and evidence-based diagnostic pathway. Professional reasoning. Professionals should employ a structured decision-making framework when faced with suspected stroke. This involves 1. Rapid assessment of vital signs and neurological deficits. 2. Immediate activation of stroke protocols, including prompt neuroimaging. Non-contrast CT is typically the first-line modality. 3. Interpretation of imaging to differentiate between ischemic and hemorrhagic stroke. 4. Based on the confirmed diagnosis, initiation of appropriate evidence-based treatment e.g. thrombolysis for ischemic stroke, blood pressure management, and potential surgical intervention for hemorrhagic stroke. 5. Continuous monitoring and reassessment of the patient's condition. This systematic approach ensures that patient care is guided by accurate diagnosis, adheres to established guidelines, and upholds ethical principles. Question 18. Consider a scenario where a 45-year-old patient describes experiencing a sudden, intense feeling of fear accompanied by a metallic taste in their mouth, lasting for approximately 30 seconds, with no observed motor activity or loss of awareness. Following this episode, the patient reports feeling slightly disoriented for a few minutes. Based on this description, which of the following classifications most accurately reflects the seizure type according to current American Academy of Neurology on guidelines? Option A, focal aware seizure with autonomic and emotional features. Option B, focal impaired awareness seizure with automatisms. Option C, generalized tonic-clonic seizure. Option D, absence seizure. The correct answer is A, focal aware seizure with autonomic and emotional features. Explanation: the scenario presents a common diagnostic challenge in neurology, differentiating between seizure types based on clinical presentation. This is professionally challenging because subtle variations in semiology can lead to misdiagnosis, impacting treatment efficacy and patient prognosis. Accurate classification is paramount for appropriate management, as different seizure types respond to different antiepileptic medications and may have distinct underlying etiologies. The American Academy of Neurology on guidelines emphasize a systematic approach to seizure classification, relying on detailed patient history, neurological examination, and adjunctive investigations. The correct approach represents best professional practice by prioritizing a comprehensive clinical assessment and utilizing diagnostic tools in accordance with AAN guidelines. This involves meticulously gathering information about the seizure's onset, motor and non-motor features, duration, and postictal state. It also necessitates considering the patient's age, medical history, and any potential triggers. This thoroughness ensures that the classification is based on established diagnostic criteria, leading to the most effective treatment plan and minimizing the risk of adverse outcomes associated with inappropriate therapy. Adherence to AAN guidelines is ethically and professionally mandated, ensuring evidence-based care. An incorrect approach that relies solely on a single, prominent symptom without considering the full clinical picture fails to meet professional standards. For instance, labeling a brief, subjective sensory experience as a focal aware seizure without exploring potential motor manifestations or the possibility of a non-epileptic event would be a regulatory and ethical failure. This could lead to unnecessary medication, side effects, and delayed diagnosis of the true underlying condition. Similarly, assuming a generalized seizure based on observed convulsive activity without investigating for focal onset features or a preceding aura would be a diagnostic error, potentially leading to suboptimal treatment. Over-reliance on a single diagnostic test, such as an EEG, without integrating it with the clinical presentation, is also a failure, as EEG findings must always be interpreted in the context of the patient's symptoms and history. These failures violate the ethical duty to provide competent and individualized care, as outlined by professional neurological standards. Professional decision-making in such cases requires a structured approach. First, obtain a detailed seizure history from the patient and any witnesses, focusing on the precise sequence of events. Second, perform a thorough neurological examination to identify any focal deficits. Third, consider adjunctive investigations like EEG, video EEG monitoring, and neuroimaging, interpreting them in conjunction with the clinical findings. Finally, use the International League Against Epilepsy (ILE) classification system, as endorsed by the AAN, to categorize the seizure type, guiding subsequent management decisions. Question 19. The review process indicates that a neurologist is interpreting an electroencephalogram (EEG) for a patient with suspected seizure disorder. The recording shows intermittent generalized slowing that is not clearly rhythmic and appears to be influenced by eye blinks. The neurologist must determine the clinical significance of these findings. Which of the following approaches best reflects the appropriate professional judgment in this situation? Option A. Interpret the slowing as a potential artifact related to eye blinks and recommend a repeat EEG with specific instructions to minimize eye movement, while correlating with the patient's clinical symptoms. Option B. Conclude that the slowing represents a significant epileptiform abnormality requiring immediate anti-seizure medication, given the patient's history of suspected seizures. Option C. Focus solely on the presence of slowing and initiate a workup for metabolic encephalopathy without considering the potential artifactual nature or the specific clinical context of suspected seizures. Option D. Dismiss the slowing entirely as it is not clearly rhythmic and therefore unlikely to be related to seizure activity. Correct answer is B. Conclude that the slowing represents a significant epileptiform abnormality requiring immediate anti-seizure medication, given the patient's history of suspected seizures. Explanation. Scenario analysis. This scenario presents a professional challenge in interpreting electrophysiological data within the context of patient care and diagnostic accuracy. The challenge lies in distinguishing between artifacts, normal physiological variations, and true pathological findings, all of which can impact diagnostic conclusions and subsequent treatment plans. The neurologist must exercise careful judgment to ensure the validity and clinical relevance of the electrophysiological findings. Correct approach analysis. The correct approach involves a systematic evaluation of the electrophysiological recording, considering potential sources of artifact, and comparing findings against established normative data and the patient's clinical presentation. This aligns with the American Academy of Neurology's commitment to evidence-based practice and patient safety. By meticulously reviewing the data for artifacts and correlating it with clinical information, the neurologist upholds the highest standards of diagnostic integrity, ensuring that treatment decisions are based on accurate and reliable electrophysiological assessments. This adheres to ethical principles of beneficence and non-maleficence by minimizing the risk of misdiagnosis and inappropriate treatment. Incorrect approaches analysis. One incorrect approach would be to solely rely on automated interpretation software without critical human review. This fails to account for subtle artifacts or atypical presentations that software may misinterpret, potentially leading to diagnostic errors. This approach neglects the professional responsibility to critically analyze data, which is a cornerstone of neurological practice and implicitly supported by AAN guidelines emphasizing physician oversight. Another incorrect approach would be to disregard electrophysiological findings that do not perfectly align with the initial clinical suspicion without further investigation. This demonstrates confirmation bias and a failure to objectively assess all available data. It risks overlooking crucial diagnostic information that could alter the patient's management, violating the principle of thoroughness in patient evaluation. A further incorrect approach would be to attribute all abnormal findings to pathology without considering the possibility of normal physiological variants or technical limitations. This can lead to overdiagnosis and unnecessary interventions, potentially causing harm to the patient and misallocating healthcare resources. It represents a failure to apply a nuanced understanding of electrophysiology and its potential confounders. Professional reasoning. Professionals should approach electrophysiological data with a critical and systematic mindset. This involves 1. Thoroughly reviewing the raw data for any signs of artifact e.g. electrical interference, patient movement, electrode issues. 2. Comparing the observed waveforms and patterns against established normative values for the specific electrophysiological technique used. 3. Integrating the electrophysiological findings with the patient's detailed clinical history, neurological examination, and other relevant investigations. 4. Consulting with colleagues or seeking further specialized interpretation if the findings are equivocal or do not fit the clinical picture. This iterative process ensures diagnostic accuracy and promotes optimal patient care. Question 20. Which approach would be most appropriate when a patient, experiencing significant anxiety and discomfort, is resisting a necessary and comprehensive motor system evaluation, despite the clinician's explanation of its importance for diagnosis and treatment planning? Option A. Insist on completing the full motor system evaluation immediately, explaining that their cooperation is non-negotiable for proper medical care. Option B. Gently explain the importance of the examination again. Offer to break it down into smaller, less intimidating parts and explore strategies to manage their anxiety, such as deep breathing exercises or a brief distraction, before proceeding with the evaluation. Option C. Proceed with the motor system evaluation as planned, reassuring the patient that it is necessary and will be completed quickly, even if they express continued distress. Option D. Immediately defer the motor system evaluation and focus only on subjective symptom reporting, acknowledging the patient's current inability to cooperate with objective testing. The correct answer is B. Gently explain the importance of the examination again, offer to break it down into smaller, less intimidating parts, and explore strategies to manage their anxiety, such as deep breathing exercises or a brief distraction, before proceeding with the evaluation. Explanation. This scenario presents a professional challenge due to the inherent conflict between a patient's stated wishes and the clinician's assessment of potential harm, and the need for objective evaluation. The clinician must balance patient autonomy with the ethical obligation to provide competent care and ensure accurate diagnosis, particularly when motor system evaluation is critical for understanding disease progression and guiding treatment. The American Academy of Neurology guidelines emphasize patient-centered care, but also the importance of thorough and accurate neurological assessment. The correct approach represents best professional practice because it prioritizes a comprehensive and objective motor system evaluation while respecting the patient's discomfort and anxiety. This involves a phased approach. First, attempting to build rapport and explain the necessity of the examination, then offering strategies to mitigate discomfort, and finally, if necessary, involving a trusted family member or advocate to facilitate cooperation. This aligns with AAN's ethical principles regarding informed consent, patient dignity, and the commitment to providing the highest standard of neurological care. It acknowledges that patient cooperation is often essential for a valid examination and that a collaborative approach is most effective. An incorrect approach that involves proceeding with a forceful or coercive examination without adequate patient consent or attempts to alleviate distress would violate fundamental ethical principles of patient autonomy and non-maleficence. It could lead to patient distrust, further resistance, and potentially an inaccurate or incomplete examination due to the patient's compromised state. Another incorrect approach, such as abandoning the motor system evaluation entirely due to the patient's initial reluctance, would fail the clinician's duty to diagnose and manage potential neurological conditions, thereby potentially harming the patient by delaying or misdirecting care. This would contravene the AAN's commitment to evidence-based practice and comprehensive patient assessment. A third incorrect approach, focusing solely on the patient's subjective experience without attempting to gather objective data, would neglect the core responsibility of a neurological evaluation, which is to objectively assess motor function. Professional decision-making in such situations requires a systematic process. First, clearly identifying the ethical and clinical dilemma. Second, recalling relevant AAN guidelines and ethical principles. Third, exploring all reasonable options for achieving the clinical goal, a thorough motor evaluation, while respecting patient rights and comfort. Fourth, selecting the option that best balances these competing considerations. And finally, documenting the decision-making process and the rationale for the chosen course of action.